This is a practical session for the initiation of continuous renal replacement therapy. We will demonstrate the essential parts and essential steps to initiate the CRRT, how to start the CRRT. طيب first we want to recap rapidly the basic principles of continuous renal replacement therapy. We mentioned previously in continuous renal replacement therapy or in renal replacement therapy, we are actually aiming either to excrete excess water from the body or to excrete small molecules or to excrete large molecules. So the CRRT machine will work on that in excretion of water, excretion of smaller molecules and excretion of larger molecules. For excretion of water, the machine suction the blood from the patient, bringing the blood through the dialysate set or through the filter, and the flow of the blood make a pressure gradient between the blood side and between the other side. Continuous flow of blood will result in water leaking out the filter and taken out of the blood. This process is called ultrafiltration. What is ultrafiltration? Ultrafiltration is a process in which we excrete excess water by making a pressure gradient between the blood side and the filter side, so the water leak from the blood from higher pressure to lower pressure. It's called ultrafiltration. In ultrafiltration, we only excrete water. Only pure water is excreted during the process of ultrafiltration. The second process is excretion of smaller molecules. To excrete small molecules, we need these molecules to diffuse from one side, from the blood side, to the other side. To make it possible for this solute to diffuse to the other side, we need to make a solution in the other side, so the solute can move from the blood, from the patient solution, which is blood, to the other solution by making a concentration gradient. So blood is coming in its size, and we add another fluid to the other side, and semi-permeable membrane between this solution, between the patient blood and between the solution that we add. When there is two solutions separated by a semi-permeable membrane, small molecules will diffuse from higher concentration solution to the lower concentration solution. This is because of concentration gradient. So if we want to excrete small molecules, we need to add solution to the filter to make this concentration gradient and to allow solutes to diffuse out the blood. This process is called dialysis. This process is called dialysis or hemodialysis, in which we excrete the small molecules. For larger molecules, when we want to excrete larger molecules, we need to push the blood through the filter with high flow and with high pressure. This high flow and high pressure will result in leaking of a larger amount of water through the semi-permeable membrane. This water, when leaving the blood going to the other side, it will drag with it, will drag the larger molecules. This is called water drag. Water drag is a process in which higher flow of water will result in dragging larger molecules to the other sides. Water drag or fluid drag or water shift or fluid shift. Also, there is another يعني chemical process occurs called convection. This convection results in reshaping of the larger molecules so that it can left out the blood. The process of removing large amount of water with larger molecules with يعني high molecular weight compounds. This process is called filtration, hemofiltration. Lastly, the dialysis filter itself, the chemical compound of the dialysis filter, the very large surface area of the filter make the filter يعني absorb some compounds, some compounds are stick to filter and not allowed to go back to the patient, in which some particles or compounds are removed from the blood by make them sticky, or by make them stick to the filter. This process is called adsorption. Adsorption is a chemical property. This is chemical property is in the dialysis filter itself. Dialysis filter can stick to يعني some compounds and يعني prevent them from going back to the patient. Adsorption. Adsorption is a chemical يعني property of the material, of the filter material itself. يعني we cannot, during the therapy, we cannot alter or change this property. So we have the ultrafiltration, the hemodialysis, and the hemofiltration. Ultrafiltration for due to pressure gradient, hemodialysis due to concentration gradient, and hemofiltration due to convection and water drag. And the adsorption is a chemical property, يعني not related to any adjustment we do in the machine. طيب. So we have three therapies that we can provide through the CRRT machine. We can provide ultrafiltration, we can provide hemodialysis, and we can provide hemofiltration. Or we can provide more than one therapy. We can provide them, all of them together. يعني we can provide ultrafiltration plus hemodialysis plus hemofiltration at the same time. طيب. Next thing يعني the CRRT continuous renal replacement therapy. يعني for CRRT usually a prolonged time of therapy is required. يعني usually we run CRRT for 1 to 3 days, 72 hours could be running. So during the CRRT usually we prefer to يعني to withdraw blood from a vein and to bring blood back to the patient through a vein, through a hemodialysis catheter. We can take blood from artery and put the blood back to vein. We can use fistula or AV graft, but for CRRT it's not preferred or not recommended يعني to use any other route than venous route يعني أو than central venous route, because it's prolonged therapy. During this therapy يعني many events can occur, including care, including يعني shifting of the patient, including for agitated patient or unrestrained patient. يعني many events can occur. So we cannot risk the fistula, we cannot risk the graft, and we cannot risk using arterial line without adequate يعني observation. Fistulas and grafts يعني are very valuable for hemodialysis patient. يعني for hemodialysis patient any يعني intervention أو any manipulation that can lead to any damage to fistula يعني better to be avoided. تمام. In fistula patients you are not measuring the blood pressure in the same side, you are not doing cannulation in the same side. All this to يعني to save the fistula. So for CRRT we are not preferring using fistula for CRRT. Although we can use it, we can initiate the therapy from fistula until يعني central venous line أو central venous catheter inserted. But overall, it's not recommended, or it's better to be avoided using any route rather than central venous catheter. So for hemodialysis, for CRRT, we are taking blood from the catheter and bringing back the blood to the catheter. Catheter is inserted in a central vein. So we drop blood from vein, putting the blood back to where the vein. So we call this is a venous process. Veno we take from vein, and venous we return to vein. It's called venous. Like it's a continuous process. So all therapies يعني provided by the machine are termed continuous venous therapy. Continuous venous therapy. Either continuous venous ultrafiltration, or continuous venous hemodialysis, or continuous venous hemofiltration. طيب, for ultrafiltration يعني if only we want to manage the body fluid status, we don't use any fluids. Usually just we connect the machine to the patient, blood coming from the patient and blood going back to the patient. This process is called continuous ultrafiltration, or it's called slow continuous ultrafiltration. SCUF, SCUF, slow continuous ultrafiltration is a process in which we are only managing fluid status. We are only removing water. In case of hemodialysis, we add fluids to the filter to make the concentration gradient. And in case of hemofiltration, we add fluid to the blood to make the volume of fluid going to the filter larger, higher flow and higher pressure. And if we add the fluid to the filter and at the same time we add fluid to the blood, at this point we are providing both of them. We are providing hemodialysis and we are providing hemofiltration. So the therapy that we can provide through the machine, first we can provide SCUF, slow continuous ultrafiltration. Second, we can provide hemodialysis, which is termed here in the machine continuous venous hemodialysis. And we can provide hemofiltration, continuous venous hemofiltration. And finally, we can provide both of them. We can provide continuous venous hemodiafiltration. So the modes of machine of CRRT, these are the modes. The SCUF mode, the CVVHD, which is continuous venous hemodialysis, the CVVH or HF, which is continuous venous hemofiltration, and finally the CVVHD, which is continuous venous hemodiafiltration. These are the notes. This rapid recap for the basic principles of the continuous renal replacement therapy. Now we want rapid look to the machine, to be aware of the machine. طبعا the machine will take blood from the patient and will take blood through the semi-permeable membrane, the filter, and will return blood to the patient. And any waste should be drawn out of the system. So this for the machine. Tamam. First of all, we have a set. This set at the end will be connected to the machine. The set containing all lines to bring blood, to return blood, to bring solution to the filter, or to bring solution to the blood. All these lines and the semi-permeable membrane are all included in the set or in the filter. Second, for the machine itself, there is many parts in the machine to be aware of. First, the screen. تمام. The CRRT machine, the Prismaflex machine, يعني has a color screen, touch screen, color coded as يعني we will discuss later. Everything in the machine is color coded. Everything has color. Every color يعني for يعني for special part of the machine. Yellow color for the waist, for example. Red color for the line coming from the patient. Blue color for the line returning to the patient. Green color for the solution that added to the filter, and so on. طيب. For the machine to continuously withdraw blood, تمام, أو to continuously recirculate blood or recirculate any fluids, we need pumps. These pumps are working to continuously recirculating or circulating the fluid. تمام. This large one, this is a blood pump. The line which is coming from the patient is entering here. This pump is continuously pumping the blood, تمام, by rotating. These small pumps are all pumps to circulate other fluids, other solutions, including the dialysis solution and including the other replacement solution. So we have five pumps in the machine. One big blood pump and four small pumps. Three pumps for the solution that we add to the therapy. We have three solutions to add to the therapy. We have the dialysis solution, which is directly enter the filter. We have the pre-blood pump solution, which coming out from the solution bag and join the blood before going to the machine. And you have the replacement solution, which is يعني added to the blood after يعني going out of the filter. So we have three solution bag. These three solution bag are circulated via these pumps according to flow rates measured in the أو يعني set it in the system. The pump is working. Finally, because continuously water, small molecules, large molecules are continuously يعني excreted from the blood, we want to continuously يعني eliminate them from the filter. So there is a line coming out of the filter and taking all this waste to an external bag, to a waste bag or to an effluent bag, to continuously clean the filter. There is a pump. This pump is continuously working, so it's continuously suctioning any waste or any effluent to take it out of the machine. So this is regarding the pumps. For the therapy to be well monitored and to be safe, machine needs to measure the pressure inside each line. يعني for example, the machine needs to measure the pressure inside the line for blood, the line يعني bringing blood from the patient. For example, if the catheter is closed, clamped or closed or clotted or kinked, يعني the machine cannot squeeze blood, so it has يعني limit of negative pressure or limit of suction. If she couldn't bring blood with this limit, it will give alarm. So the machine needs to monitor the pressure inside the blood. So these ports are called pressure ports. These pressure ports are pressure sensors. This pressure sensor, the line is connected at this area to continuously measure the pressure inside the line. If the pressure go beyond the allowed limit, the therapy will stop and alarm will appear. We have two pressure pots here for the blood line, and we have one pressure pot here. This one pressure pot for the effluent or for the waste bag. If the bag is full, or if the line is clamped, the machine cannot يعني take out the waste. this pressure sensor will sense the pressure and will give alarm and will stop يعني infusing through the line. طيب. Also for the machine يعني after processing the blood need to go back to the patient, and the blood need to go back to the patient in يعني in a good way. One of the common يعني problems occurs during CRRT is air bubbling that formed and occurred in the filter. These air bubbles يعني should not be traveled to the patient. Because of these air bubbles يعني enter the circulation and go to the patient, it will cause problems يعني it will cause يعني air embolism, gas embolism and other problems. So the machine want to make sure that it can clear any air bubbles formed in the system, and يعني it want to make sure that the blood going to the patient يعني containing no air. So from this side the return start. يعني from this side, this is the side in which return line to the patient, which is returning blood back to the patient, start at this side. يعني blood going out of the filter, تمام, and from this side it's return start. So first at this area we have يعني we have something called air chamber. This air chamber blood is going back to the air chamber. If there is any air bubbles, the air bubbles will not go through the blood. It will be يعني it will go up, and finally this air chamber is connected to this line. So any air يعني accumulated or any air is traveling with the blood, first will go to the air chamber, second from the air chamber it will go out the system, and the blood that is going to the patient will be يعني free of air, no air in the blood. Second, for the machine to make sure no air is going to the patient, the line is put through this sensor. This sensor is called air detector. يعني after blood going out of the air chamber, blood will go inside this sensor. If any air bubbles يعني يعني escape or leak through the air chamber and went into the line, the air detector immediately will detect air in the blood or in the return line, and immediately it will give يعني alarm and will stop the therapy. طيب, we have also يعني the blood is coming in the filter in the semi-permeable membrane. This filter should only excrete water, small molecules and large molecules. Blood should never go to the other side. يعني blood cells that is coming from the patient should all go back to the patient. No blood is allowed يعني to leak to go to the other side, and no blood is allowed to go to the waste bag. If blood is go to the waste bag, then we are losing blood, and this is equal to hemorrhage or blood loss. So for the machine, there is a sensor here. This sensor, يعني the effluent line, the line which is taking the waste, is coming through this center before going to the bag. This sensor is called blood leak detector sensor. This blood leak detector continuously monitoring the flow of the effluent. It contains water, it contains small molecules, it contains large molecules. For the detector, no problems. But if blood cells or blood is going through this sensor, immediately the sensor will sense the blood and will give alarm, blood leak detected. تمام. يعني for example, if any area of the filter is damaged because of high pressure and resulted in small amount of blood leaking out, if this blood is go out the filter through the waste line or the effluent line, this sensor will detect the blood and will give alarm, blood leak detected, and the therapy will stop immediately to prevent further blood loss. طيب this valve here, this valve, this is called safety valve. This safety valve, whenever there is a major problem like blood leak detected or like air detected in the return line, therapy should be stopped. This safety valve, whenever this events occur, this safety valve will immediately close the return line and prevent the therapy from continuing. So this is the safety valve. تمام. safety valve, whenever air detected or whenever blood detected, safety valve will close and will prevent blood to go to the patient and will stop the therapy. طيب. Finally, during CRRT, we usually use طيب during CRRT we we need to use anticoagulation because any blood any blood go out of the blood vessels. تمام. Physiologically it should clot. So the journey of the blood throughout the set and the filter make it for the blood possible to be clotted. To prevent this clotting, we add anticoagulation to the blood to prevent clotting of the blood outside the body. So usually we prefer to use anticoagulation. We can use continuous anticoagulation, infusion of anticoagulant medication, or we can use boluses of anticoagulation. We have mainly two options. We have the high molecular weight heparin or the unfractionated heparin, and we have the low molecular weight heparin, which is enoxaparin. And the high molecular weight heparin, the unfractionated heparin, is the preferred. The continuous infusion of unfractionated heparin is the preferred method for anticoagulation during CRRT. If we are going to use continuous infusion of high molecular weight heparin, or if we are going to use boluses of low molecular weight heparin, we add the anticoagulant to a syringe. This is a built-in syringe pump. This built-in syringe pump will provide or will infuse the anticoagulant to the system according to the infusion rate or to the boluses that required in the system. So this is syringe pump. This syringe pump for anticoagulation. تمام. طيب. Finally we have the scales. تمام. These are called the scale.